Hi there. I just wanted to update again. I just had my MRI for my parotid gland tumor that I have on my right side. It's comparing it to other people's, it's actually pretty small, but it's in a really awkward area. So anybody that has to go in for an MRI, I had it with contrast, so they had to put an IV in. They asked me not to eat or drink 4 hours beforehand, so not sure if that's normal for everybody. And because of the area that it was in, I was not able to have the headphones on because the MRI is very loud. But they did let me have earplugs, and because it's so tight in there too, I actually asked for like a sheath over the top of my eyes, which made me definitely more comfortable. But the whole MRI, all the different parts that they had to do, specific to what my doctor wanted, the MRI actually took a full exact hour from start to finish. So I got there at, I think, 11:45, started by 11 or by noon, and then I was out at pretty much exactly at 1 o'clock. So I haven't heard any results yet, and my surgery is scheduled for the 28th of August. I had my pre-op appointment yesterday, so I had the MRI and then the pre-op appointment, which is just, it was actually really great. Any questions that I had were answered. Kind of the details of what the day will entail, because it's not really considered an overnight, but it's a 23-hour stay. So I'll have surgery in an afternoon on that Tuesday afternoon because my doctor has rounds in the morning, clinicals. And then I'll be in the surgery. You said anywhere from 2 to 3 hours for the surgery, but you know how it goes, start to finish. I don't know, they get you prepped and ready, and then you just kind of sit there. So I'm hoping, and they said my husband can sit with me, so that's great. And then after the surgery's done, you go into recovery, and then from recovery, they tell your family or spouse or what have you to go to the room, and they'll wait for you there, and then they roll you in the room, and then everything kind of starts. So they went over all of the pain medicines that I'm going to be having, and actually how the incision is going to look. This specific doctor actually doesn't use stitches. They use the dissolvable ones, so it should be a pretty nice clean scar, which I don't really care about. I wear my hair over 90% of the time anyways. But just wanted to touch base with everybody. I'm feeling fairly at ease. I'm a little anxious for the results and the pathology. They did do the biopsy and they said it was fine, but you know how it goes until they send the whole thing in. And a little anxious to hear how the MRI looked, whether my nerves were over the top of the tumor or underneath. So underneath it's going to be a little more grafting. Oh, that's the other thing. So a lot of people said that they're kind of left with a big hole in the side of their face. My doctor is going to make an incision on my stomach. I thought it was going to be lipo, so I'm kind of sad, but I have plenty of fat to take out. But they're going to do an incision on my stomach and take some fat out of there and then just close it back up. So they said I'll probably be almost, pretty sore from that too. Having more fair skin, I'll probably bruise. But yeah, that sounds fairly simple to me. Like I said, I was disappointed, that they weren't doing liposuction, but so I'm just trying to keep an open mind, and support from my family is great. And I think my youngest daughter will be back in town by then. They'll be moving, and they can come and help support me too, kind of through the healing process. And I made my follow-up appointment, so I have the surgery on August 28th, and my follow-up appointment is set up for September 5th. So I don't believe, as far as I know, there won't be any stitches to take out because they're dissolvable, but they're just going to make sure that everything is healing well and such, so including the incision on my stomach. That's about it. It's been about a 5-minute update, and so next time I will try to post maybe before my surgery, the night before, all the butterflies that everybody always gets, and just all the prayers to the people going through this, and maybe you can reciprocate and do some little prayers for me too. So I'm just going to sign off, and I'll talk to you the night before my surgery. Take care. Bye-bye.